How has post-coital urination advice changed for UTI prevention? You might have heard that peeing after sex can help prevent urinary tract infections, but how has this advice evolved over time? For decades, health experts have recommended urinating soon after intercourse to reduce the risk of UTIs. The main idea is that urinating helps flush bacteria that may have entered the urethra during sex, preventing them from multiplying and causing infection. This simple, non-invasive step has been a staple in personal care routines for women and men alike. In recent years, medical guidelines still support this practice, but with some added details. Experts now often suggest urinating within 10 to 30 minutes after sex, as this window might be most effective for clearing bacteria before they can settle in. The advice remains consistent because it is easy to do and carries minimal risk. It is also recommended alongside other habits like staying well hydrated, practicing good hygiene, and avoiding irritants that can inflame the urinary tract. However, it is important to understand that the scientific evidence backing post-coital urination is limited. While many health authorities consider it a reasonable step, it is not a guaranteed way to prevent UTIs. Its effectiveness varies from person to person, especially in those who are prone to recurrent infections. For some, it may significantly reduce the chance of infection, but for others, it might have little impact. In cases of frequent UTIs linked to sexual activity, doctors sometimes suggest taking a single dose of antibiotics right after sex. This approach, called post-coital antibiotic prophylaxis, is more targeted but is not recommended for everyone. It is usually reserved for people with a history of recurrent infections and should always be guided by a healthcare professional to avoid antibiotic resistance. From a broader perspective of bladder health and bladder cancer prevention, the focus is on reducing irritation and infection risk. While urinary tract infections are not directly linked to bladder cancer, ongoing inflammation from recurrent infections might contribute to bladder irritation over time. Therefore, maintaining good bladder health through preventive measures like post-coital urination, hydration, and hygiene is part of a comprehensive approach to urinary health. In summary, the advice to urinate after sex has remained largely unchanged, still recommended by major health organizations as a low-risk, helpful practice. Its role is supportive rather than definitive, and it works best as part of a broader strategy of good hydration, hygiene, and medical care when needed. If you have frequent UTIs or specific concerns, talking to a healthcare provider can help tailor the best prevention plan for your needs. Remember, individual experiences vary, and personalized medical advice is always the safest route.